Sedev Bhatta breaks down as he pleads with staff in India's biggest COVID-19 hospital to admit his wife Lakshmi. She's lying in the back of an ambulance, breathing with the help of an oxygen cylinder. He tells Al Jazeera they came here after being turned away by other hospitals.
I have no one else except my wife and child, who I've left on the road with an acquaintance. There's no one to look after us. We aren't getting a bed, and I've tried many hospitals, but there's no one around to give us a bed. With folded hands, I have pleaded with the acquaintance to take care of my child.
Tensions run high outside the hospital, where family members tell staff they have nowhere else to go. But Lok Nayak already has 1,850 patients and only 1,500 beds. Staff told us hundreds are lying on the floor.
Our work is very hard. We try to help and guide people, but they don't listen. People are becoming very frustrated. Some even become physical.
But eventually, after waiting for hours, most give up and begin their search for a bed again, hoping to find a hospital where someone has been discharged. Despite being India's biggest COVID-19 hospital, staff at Lok Nayak told us it too is running low on oxygen supply. When the Delhi regional government took the matter to the High Court, India's Solicitor General told it, "Let's try and not be a crybaby." 50 people died in the capital after their oxygen supply ran out. And on Saturday, 6 patients died in the state of Punjab because of the same reason. Healthcare workers say they are helpless in the face of such a calamity.
We need oxygen immediately, and our persons are wandering here and there for oxygen, but there is no help, no hope.
Sedev Bhatta leaves Lok Nayak after his ambulance driver tells him his wife will die if they keep waiting there. Elizabeth Puranam, Al Jazeera, New Delhi.
Dr. Ritesh Malik is the director of RADIX Healthcare, private hospital in New Delhi. He says India is facing one of the biggest battles in its modern history.
We are in the midst of one of the most grievous challenges our country has faced since the partition of 1947. We are seeing a very, very vulnerable population continuously in search for oxygen, basic beds, remdesivir medicines, and things even like paracetamol in smaller towns in India. 0.35 million new cases each day are being recorded, and this is when we do not have adequate testing happening on ground. We are seeing a massive surge of young population getting affected by the second wave of COVID. And I truly believe that we have not achieved the peak yet. We are going to see the peak in the coming 1.5 weeks from now. There is massive shortage of oxygen in our hospitals. Today morning, we just had 10 minutes of oxygen left in our own hospital. There have been more than 45 deaths, recorded deaths in Delhi, large Delhi hospitals because of lack of oxygen. And we are on oxygen SOS calls. And until and unless the government provides us with oxygen, which is an essential medicine to fight COVID, this is the only medicine which actually works. This is something which is the need of the hour. And if we do not do that, we will see a lot of bloodshed in Delhi and other parts of the country. I believe that any patient who dies, can you stay or can I stay without oxygen for even a minute? The answer is no. Oxygen is a basic necessity, and especially for a disease like COVID, wherein remdesivir, Fabiflu, and other drugs have questionable clinical trials. Oxygen is the only essential medicine. We have something by the government called the Essential Medicines Act. In that, the first medicine is oxygen. And if we do not have oxygen, how do we fight a pulmonary infection like COVID, which is so grievous in nature and so infectious?